So John McCain's announcement that he would not support the new health care reform bill pushed by his friend Senator Lindsey Graham has essentially killed any hope of health care reform this year. So how do we all live with the dysfunction of Obamacare? Dr. Marc Siegel, Fox News medical correspondent, joining to help. Is it all just going to continue to get worse? We're going to have rising premiums, we're going to have rising deductions, and we're going to lose doctors.
Yeah, and lose insurance companies. There's no question that that's the direction we're going in, because it all starts with a mandate that isn't popular among our people and doesn't work. It doesn't work to mandate that a young person buy a bronze plan for $3,000 a year rather than taking a $1,000 tax penalty and waiting till they get sick. And Aetna says, wait, if you wait till we get sick, we're going to drop out of that market. That's what's been happening.
Well,
and then premiums spiral up.
As not only a doctor, but also somebody who tries to figure out what's going on with public opinion, whether people are going to be so disgusted with what happens that they may be drawn into a socialist alternative. And, of course, Bernie Sanders, in addition to Vice President Pence, do we have that soundbite, producers? Bernie Sanders was just talking about all this, what has happened with Republican leadership failing to get enough votes to change Obamacare. Let's just play Bernie Sanders.
And we say to Mr. Trump and the Republican leadership, you are not going to allow thousands of Americans every single year to die unnecessarily. We're not going to let you pass that horrific legislation.
And, of course, his horrific legislation, from my perspective, is socialized medicine. That's the worst of all solutions.
To give you a minute on that, his plan will cost $32 trillion over 10 years. According to Urban Institute. His plan will lead us to a system like Canada has, where your average wait time between the time you see a generalist like me and get treatment from a specialist, elective treatment, is 20 weeks. His plan will erode the employer-based market system, which actually works here in the United States, and most people are happy with 170 million people. It's not going to happen here, single payer. Not going to happen.
Meantime, we have Obamacare, and I'm just wondering if a lot of doctors, such as yourself, who are fed up with all the paperwork, all the mishmash of what happens with Obamacare, are going to go off the grid. That is, they're just going to say, look, my clients have such high deductibles that they may be willing to pay cash out of their pocket to see a doctor. Just forget about insurance companies, forget about the government.
Let's talk about that. The biggest point you just made that I agree with is about the deductible, David. Somebody comes to my office. They have a thyroid problem. I want to get a thyroid ultrasound. They say, I'm sorry, it's in my deductible. I'm not going to get it. Puts a liability on me. Puts a liability. I need them to get the test. They can't afford it out of pocket. The insurance doesn't cover it. That's Obamacare. You're right. Concierge medicine is now building up to take its place. Tell you what the problem is with that. If you're a concierge internist or family practitioner, you can promise the world, but you don't have the specialists to refer to. You know, I have to be in a certain network. And, of course, Obamacare networks don't work either because they're very narrow. Right. Many major hospitals don't take them. But concierge, I can't get the orthopedist I need. I can't get the obstetrician I need. They don't play ball with it. So we're in a situation where, yes, concierge will grow, but it's not going to solve the problem.
The quality will go down, but the market will provide some solutions. Anyway, Dr. Siegel, good to see you.
It's not a good time for health care. I almost wish we could get back to the Nixon plan, where we just give a card to people who can't get it any other way.